For our next panel, municipal, state, and federal panel, rather. Good to see you all. Good to be here with you. I want to welcome you all back. Also, another reminder is no food and drink in the auditorium. So to tee up this panel, I'd like to share a quote from the seminal article that Ta-Nehisi Coates wrote in The Atlantic back in 2014, the case for reparations that many of us have read. He details the long and historic history of brutality, theft, oppression, and degradation directed at Black people for generations after the Civil War. And he writes, now we have half stepped away from our long centuries of despoilment, promising never again. But still we are haunted. It is as though we have run up a credit card bill and having pledged to charge no more, remain befuddled that the balance does not disappear. The effects of that balance, interest accruing daily, are around us all. So we've heard a lot about that balance, the extent of both the wealth gap and the health gap in our last panels. And this next session will explore how to begin to close those gaps, to pay down that balance, to move towards repair at the local, state, and federal levels. You will hear from people doing that work day in and day out. So I'm so pleased to introduce our moderator who is going to join us virtually, or going to introduce our moderator, but our introducer is going to join us virtually. We had a little change up for today. Dr. Alecia McGregor. She is an assistant professor of health policy and politics at the Harvard Chan School. And Alecia played a critical role and a crucial role in organizing this entire symposium. And I can't wait to hear from this panel, and she's going to introduce Dr. Natalie Linos, who's going to moderate the next panel. So I'm going to turn it over to you, Dr. McGregor.
Thank you so much, Aletha, for the introduction, and good morning, everyone. It's truly an honor to have been a part of this initiative, and it's an honor to be here today to introduce a panel of such an outstanding and inspiring group of speakers. In this part of the conversation, we'll be turning to some of the nuts and bolts, if you will, of reparations, what these programs look like so far in practice, and what they might look like in the future across the country. Now, in the Federal Republic of the United States, it might seem like we have a very long tradition and frustrating tradition of pushing large-scale and potentially transformational social policies to the state and local levels to do the work. Now, this causes some concern because advocates worry that leaving these changes to states and cities can result in a slow path of insufficient and incremental reforms, or worse, no change at all. And we've seen this take place with national health insurance reform, which we've been at for over 100 years as a country. Now, another factor that might make some wary about pushing these changes to the subnational level is that states' rights have long been invoked to allow anti-Black and segregationist logics to dictate the policy designs of social programs. For instance, the decision to allow states to opt into the Medicaid expansion that came with the Affordable Care Act, this decision has resulted in a very lopsided distribution of which states have expanded Medicaid and which haven't, wherein the majority of states that have not expanded Medicaid have populations that are more than 50% people of color. And that's not a coincidence. At the same time, we know that states and cities are known as the so-called laboratories of democracy and policy, where elected officials and advocates can potentially experiment with policy designs and allow what cannot get done at the federal level to see the light of day. In the case of Black reparations, we're seeing state and local actors take matters into their own hands in places such as Evanston, Illinois, Asheville, North Carolina, and right here in our own backyard in Boston and Cambridge. This panel will give us a glimpse of how this is taking shape right here and across the country. With me today are Councilor Julia Mejia. She's the first Afro-Latina to sit on the Boston City Council and she was a driving force behind the effort to prompt the city to consider reparations for Black residents. This ordinance is up for discussion in a council meeting this afternoon, so we'll look forward to hearing updates on that after the symposium today. Councilor Mejia was also born in the Dominican Republic. She was raised in Dorchester, and she represents the city of Boston as a councilor at large. Welcome, Councilor Mejia.
Thank you.
Our second panelist is Yvette Modestin. She's the founder and executive director of Encuentro Diaspora Afro in Boston. She's a founding commissioner of the National African American Reparations Commission, and she's the diaspora coordinator for the network of Afro-Latin American, Afro-Caribbean, and diaspora women, which is part of the UN Office of Women. Yvette is also the ambassador for reparations for the Rastafari Alliance of Panama. She worked closely with Dr. Camara and Councilor Mejia on the Boston Reparations Ordinance. Welcome, Yvette Modestin. Third, we have Rue Simmons. She is the founder and executive director of First Repair, a nonprofit that informs local reparations discussions across the country. She's a former alderman in Evanston, Illinois, and she led that city's work on reparations, work that's being featured in the documentary, The Big Payback. And we've just learned that that documentary has been picked up by PBS and will be live streamed on Martin Luther King Day in January. So congratulations, Robin. Now, last but certainly not least, we have with us Saskia VannJames. She's the Director of Racial Justice and Health Equity Policy at the Massachusetts Recreational Consumer Council, a Black, brown, women, queer-led organization moving in solidarity for racial healing and reparative justice from the war on drugs and transatlantic slave trade. She is also the co-founder of Grow to Consume, a free Boston public health education program on soil health and cannabis plant health to address environmental racism and medical racism through a reparatory justice approach. She is also a community organizer for Municipal reparatory justice policies in Cambridge. So welcome everyone, and I'm going to turn it over to my colleague, Natalia Linos, to facilitate the rest of this panel. Thank you so much.
Thank you so much, Professor McGregor. And we're so sorry that you're unable to be with us today. As everybody on this panel knows, Dr. McGregor was instrumental in organizing the whole symposium and especially for this panel. And we're sorry you're not feeling great, but hope you feel better soon and that you will stay with us listening in the background for this conversation. And so let's just jump right into it. We have about an hour. We're going to spend the first 40 minutes with some questions that have been pre-prepared by Dr. McGregor as well. So I will be reading. I apologize since I'm stepping in at the last moment. But we do have about 20 minutes at the end for Q&A. So listen in. These are people who are used to having questions asked at them and stand at the mics towards the last 20 minutes. So I'm going to start with a broad question to give you each a chance to introduce yourselves and the work you've been doing. And Councilor Mejia, I'm going to start with you. The reparation ordinance you introduced in the city of Boston takes a clear-eyed look at the ways Black people have been oppressed, exploited, and discriminated against over the centuries, starting with the fact that slavery was legal in the earliest days of the colony of Massachusetts and moving on to document enduring discrimination in housing and educational opportunities, leading to a wealth gap that the ordinance calls disgraceful. Can you please walk us through some of that work? In the previous panel, we heard a little bit, some glimpses, but really what went into developing it, the political response, and really some of the next steps.
Thank you for that. Can you guys hear me? Yes? Okay. So thank you for inviting me to be here. I'm really excited. So for you to understand the political landscape, I'm sure you know that Boston is also notoriously known for being one of the most racist cities in the country. And so it did take a lot of political will to first introduce this as a concept here in the city of Boston. It was in 2021. At the time, I was running for office for re-election, so many folks thought it was consider political suicide to bring this into the discussion. And for me, it wasn't really so much about political suicide. It was what was the right moment at the right time to really push the conversation. And if we're really serious about repairing the harm, then we need to create a platform for that. So a lot of the work had already been laid down. There are organizations that have been doing a lot of work around changing the name of Faneuil Hall. The New Democracy Coalition has been a big voice in the city of Boston in terms of the Faneuil Hall and trying to really remove symbols that trigger communities. And I was approached by Tanisha Sullivan, who is the president of the NAACP, with the idea of, and for those who know, the NAACP has been front and center with a lot of issues around educational equity, economic empowerment. So they presented an opportunity for us to work in collaboration to write a hearing order for just to have a discussion around reparations. And through that, community organized, because that's what people do, right? And partnered up with King Boston, Yvette, Dr. Kamara, and a host of other folks who have been doing this work. We see our role in our office as more so the vehicle, the legislative vehicle. My job is to step to the side and really create space for community to really dictate what this looked like. And so it was through their leadership that we were able to create the conversation last year. And as a result of that conversation, let me just tell you, the troops came and let everybody and their mother know that it was reparation time here in the city of Boston. Yes, and through that work, and that was all credit to the community activists. You know, our role, again, was just to create the container for the dialogue to happen. And as a result of that, it was determined that the city of Boston was prepared to actually file an ordinance so that we can start studying what this would look like. And we worked in collaboration with Yvette, Dr. Kamara, to write the ordinance that was filed in January. And now we're going to, you know, there's been a lot of politics happening in the city of Boston, if you've been following. But we are now at a place today, this afternoon, where we're going to, we held a hearing. That's the first part when you file an ordinance. But after the ordinance is filed, the next set of steps are really working with the council and the administration to fine-tune the language so that you can bring it up for a vote. So today's discussion will be with our city council colleagues to go back and forth in what this piece of legislation will look like before we bring it up to a vote. So that is all the work that we've done over the last 2 years, but it's been in deep partnership with those who are living the realities and actually really doing the work.
Thank you so much. And, you know, it's important to acknowledge that the School of Public Health is part of Boston, and we are proud of what you're doing and really happy to partner and be seen as a community voice. And today's symposium, we intentionally wanted you to be here, and then we also wanted Cambridge to be represented. So Saskia, I'm going to turn it to you next, because that's the rest of Harvard is on that side. You know, you've been working to jumpstart a similar conversation from the community organizing side across the river in Cambridge. You're pushing for a permanent reparations department in the city, which you see as being more durable and potentially more effective than a commission. Can you bring us up to date a bit on those efforts across the river too?
So right now in the city of Cambridge, we've passed policy for a racial justice and equity commission, which is really a preliminary step to creating a reparations department. And I'm really pushing for a reparations department for a couple of reasons. But first, I just want to let you guys know every city operates different, okay? In Cambridge, our city councilors can have nothing to do with the forming of a commission. It is illegal for them, actually, to participate in the forming of a commission. It's really, really beautiful because it forces for this to be a community-led process. And so our commission that we're forming right now, it is the entire, like, Black Cambridge is coming together. And we're having conversations. We're developing, when we meet, community-led, where it's a whole community-led process. And who's going to be on here, and really addressing some of the questions that's really interesting that's coming up now. How are you going to have people on this commission if they've been complicit into systems of oppression, right? So if you have people that work with police, how can they properly represent repairing the harm? These are very complex questions that we're discussing now as we're developing the body for the Racial Justice and Equity Commission. But we also have a reparations fund, and then in Cambridge, we have a restitution fund from the war on drugs. This is really critical because the war on drugs has really been spoken about through a lens of just cannabis, and it's centering a plant instead of centering the people.
Oh, sure.
And so I really had to push back on this conversation that's been occurring because it's completely whitewashing an international war, genocide that's occurring. Right? We have people that came up into Massachusetts from Honduras, some partial Honduran, partial African American. I care about these things. And where's the funds, right? So in Cambridge, we have a restitution fund from the war on drugs. And part of this commission will be to assess the reparations fund and to give recommendations on how that money is to be used, as well as a restitution fund. And we hope that other cities in the state will follow suit and develop a restitution fund from the war on drugs and really step back. Let the conversation of social equity be one from yesterday. And in regards to the reparations department, we feel that this is critical because you have institutions that have whole departments that have caused harm. Now, if you're saying that you're going to bring people to the table, they need to be equal, right? So you've invested in whole departments, say police, because this is a founding colony, right? And then you're going to have a commission? No. We need to have a department. We need to have people equally invested to address systemic racism. And then within this commission, we need a multitude of voices because reparations is very complex. The harm that has occurred for African Americans is very different than for my Caribbean folks. And my Caribbean folks need their own spaces. So part of repairing the harm is also addressing intertribal harm that has occurred. I speak with a lot of my Caribbean folks and they let me know, like, you know, in my country, the church had us watching videos and they told us to stay away from African Americans because you guys are too violent and you don't care about your own selves and you just shoot each other and kill each other. So there's very real complications that's occurred from you know, institutions, you know, white-powered institutions that have interfered and caused intertribal harm within the Black community. So I really have to stress, like, Black is not a monolith. We need to really, when we do repair work, think about it through an intersectional lens and allow our tribes to have their space and their voices so that we can repair the harm as a holistic approach.
Thanks so much, Saskia. And I think that the question around people who are complicit and how do you work around that when the system is what it is today is a really important one for the whole day. And, you know, while we started in Boston and Cambridge, I do want to step back and turn it to Robin. Robin, you led the work in Evanston that resulted in the nation's first municipal funded reparation initiative for Black residents. Disbursements under that legislation began earlier this year, if I'm correct, and it's important for everyone here to hear that story. So please walk us through your work in Evanston, the progress so far, and, you know, if there are any lessons that, you know, you want to share. The hope of today is that we are learning from each other just as much as sharing stories.
And we're still learning in Evanston, right, because there was no example or model. Just really excited to be here, excited about what can come out of Harvard with its commitment and study and $100 million. So just shout out to Harvard for that. In 2019, while I was elected, I was councilwoman in my city. I had the revelation really that local reparation was really the only sufficient legislative next step. Equity initiative had not been enough. We had done every form of acknowledgement. In fact, we had done over 100 resolutions that were in the name of Black Lives Matter, we care, we're inclusive, and so on. Unlike Boston, we're actually known for being welcoming, inclusive, diverse, and so on, progressive and liberal. But very much like Boston and every place else in this nation, we have the racial gaps, wealth, home equity, health, life expectancy, and so on. And so in that moment, I was feeling, you know, like our city really was making a mockery of the Black community. We were self-congratulating ourselves all the time on how well-intended we were with non-tangible resolutions and proclamations that didn't have budgets, and so we needed repairs. So I knew that it wasn't just the crimes of the transatlantic slave trade and federal harms and crimes against Black communities like redlining, But our city too had done something and some things, many things, that were anti-Black and harmful, and we could measure them, we could document them, not only through oral history, but we know that our city had anti-Black policies. And so what we did was we started a process that started with community engagement. And we called our Black community to meetings to hear from them, like, what is the harm? What does repair look like? What does it mean to Black Evanston? Who should be eligible? So it led with the community process and then began a pretty complicated legislative path that we didn't have a reference to. And so that started in actually April of 2019 with our first public meeting. It went to our Equity Empowerment Commission, which we have in Evanston. And there it worked through a series of meetings, dozens of different types of meetings, committee, back and forth to council for consensus and back for rework. But in November of 2019, we passed Resolution 126R19. It establishes the Reparations Committee. It commits our first $10 million of recreational cannabis sales tax to begin funding the work of reparations. And it prioritized our remedies based on Black community feedback. And those priorities from the Black community were housing, economic development, and educational initiatives. And so it's important to note that our Black community had a long list, and all of this is available at the City of Evanston's website. You can see what Black community said, and every Black community has the same sort of feedback. We want it all. We want every form of repair, full repair, all 5 components of repair. But we had to do what was within our purview, and we led there. We have passed our first initiative, which is a housing initiative. It's $25,000 direct benefit for eligible Black residents, and we have begun dispersing reparations in Evanston. We started earlier this year, and today I'm just coming from a virtual council committee meeting where we have the tall task of identifying additional revenue streams, identifying next remedies, and calling to action other institutional accomplices. Although the City of Evanston is responsible, so is our healthcare system, our school districts. Northwestern University has been silent on reparations, and they have a history of anti-Blackness in our city. And so we are continuing to do the work in Evanston. We've had broad community engagement. I really want to shout out our interfaith community that stepped up in a major way in educating ally communities, as well as raising funds to expand the reparation benefits in Evanston.
Thank you so much, Robin. And as you know, we heard earlier, it takes courage to be the first. So thank you for stepping up and continuing and moving us forward. So Yvette, you're an activist, a poet, an artist, a writer, a community organizer at the UN, and also work overseas focusing on health of women of African descent. And I'm hoping you can take us a little bit to that conversation, a national and a global perspective. How do you see the reparations movement growing and changing here in the US and around the world? And yeah.
First and foremost, giving thanks to those whose shoulders we stand on, wanting to honor 2 ancestors that have guided me to be able to sit here with you today, which is City Councilor Chuck Turner and Senator Bill Owens. So I give thanks and guidance. And also wanted to, although I am here and Councilor Mejia is here, I want to honor the work of my colleagues, which has been a collective work here in Boston to get us to what we're about to do this afternoon. And I'm going to take my time and call their names out because I think it's very important. Tisha, Joelle, and Imari of Embrace Boston, Dr. Kamara, Dr. Vandermeer, Dr. Cuff Ferguson of UMass Boston, Kevin Peterson, Carrie from New Democracy, Tanisha Sullivan of the NAACP, Aziza Robinson Goodnight, longtime community activist. Did I miss anyone? I think that's everyone.
Reggie, you ready?
Oh, and Reggie Stewart, who works with Encuentro Diaspora Afro. And I think it's important because we all come from different perspectives, but it has been a collective work. Although I co-authored the ordinance with Dr. Kamara, it was not without the input of everyone that I just called out. So I would like for us to give them a hand. You know, I had shared with Natalia and Alecia that coming back to this building today is coming back to my old stomping ground. As a clinician, I worked 7 years here at Children's Hospital. And I have to answer the question first by saying, we don't see Black people in Boston. Institutions don't see Black people. I, as a social worker, struggled working in the domestic violence program and having to advocate for the women that I was working for right here, who were treated like if they were coming from the outside, and folks coming from the outside were treated better. And that was right down the street at the #1 children's hospital in the country. So I learned from early on, health is not just our physical health. We want to be seen. We are not seen, Black people, in our human life, donde sea que estemos, en cualquier idioma que hablamos, wherever we are, whatever language we speak. Being Black is a constant issue of repairing. It's a constant issue of being seen in our human life. It's a constant issue. My health is part of when I get up every morning and walk out in the street. My health is every time I go into a store. My health is when I go into my supermarket. My health is my housing, which is a human right. Boston is the second largest, most expensive place to live in the country. Folks are not able to live where their community, their village is, to be able to get the support that they need. Now, that's the same thing I see everywhere I travel in Latin America and the Caribbean and Europe. The only difference is we all come and speak the colonizer's language, but being Black is just being Black anywhere. I'm preparing to go to Brazil for the 30-year anniversary of the network. 150 women from all over meeting in Salvador, Bahia. I've had friends, women killed for sitting and doing the same thing I'm doing right here. Marielle Franco, Brazil, killed on the streets for demanding the repair of Black people in Brazil. Francia Marquez, who's now the current vice president of Colombia, is constantly living under threat. So as Professor Kamara in the last panel spoke, for us to, the US impact on everyone is a reality. So what happens here impacts everyone else, and what happens there impacts us here for those who migrate. I'm gonna give a specific to the global piece. I am born and raised in Panama in the American segregated territory of the Canal Zone, in Jim Crow segregation laws, where every American implemented law was imposed on this territory. Yet, Brown versus the Board of Education passed in the late 50s, we did not desegregate school till 1978. I was born in the same hospital as John McCain. I came out Panamanian, he came out American. So the reparations question and how this country has played its role in other places is real. My grandfather got on a ship from Martinique as a young man to build the Panama Canal as a free Black man born into slavery, but yet was faced with a level of slavery by the US government in this territory. This continues today. This is not an isolated conversation. This is not a past conversation. This is a current conversation. In the last couple of weeks in Boston, our violence has been on an upkeep. The displacement of our community is on an upkeep. The inequality of Black women's health is on an upkeep. And that is the same conversation I'm having with my colleagues from Guatemala, from Peru, from Honduras, from Colombia. If you are Black in this world, you are constantly in a conversation about how do I repair? how you see me. Because how you see me affects my health on a daily basis. It affects how I see myself. It affects how I hear myself. And if we don't get it right, we have a young community walking all over the world, but in these streets of Boston, living schizophrenic lives. Because at home they are told, keep your head up, do your education, do this to get here, to do that. And then they have to walk out in the street and get the opposite message. Art is a way to heal and to have a conversation. And writing is always a place to find that conversation and that healing. And I want to, as a writer, you're always looking for inspiration and you're looking to see where truth lies. And I wanted to read this. Life, inexhaustible, goes on, and we do too, carrying our wounds and our medicines as we go. Ours is an amazing and spectacular journey in the Americas. It is so remarkable, one can only be thankful for it, bizarre as that may sound. Perhaps our planet is for learning to appreciate the extraordinary wonder of the life that surrounds even our suffering, and to say yes, if through the thickest of tears. Alice Walker from the book Barracoon. We are extraordinary people. Blackness is an extraordinary thing. The fact that we are still getting up and standing with the level of inequality that exists in the world, in these streets in Boston, says a lot about who we are as a people. When they dragged our ancestors on that ship, that spirit still lives within us to be resistant to the maltreatment that we face on a daily basis. My hair is a topic of conversation. It was not till March of this year that the Crown Act was passed in Boston that allows me and Robin and all of us up here to wear our hair however we want to. So that's part of my health. Someone telling me I can't wear my hair the way I want to wear my hair is about reparative justice. So I don't see this as an isolated conversation from the daily lives that we live.
Thank you so much, Yvette, and thank you for... And thank you for bringing us back to sort of the question at the end of this statement. We're here to talk about municipal action, but also where is health? And I want to acknowledge that every one of the speakers spoke about the collective power, the people, the organizers. And I wonder, there are people in this room who are students of public health, medical students. I want at the end of this panel for them to feel that they can join this table that you have opened up and welcomed. And so I'm going to come back to you, Julia. I know you have worked in public health, so I want to give you a chance to speak a little bit about how you see the health harms manifesting themselves, why you hope reparations could uplift health. And I add this question: how can those of us in public health join your sort of call for join the movement?
Well, so if you don't know who I am, I'm going to let you know right now. I'm going to put everybody here to work because this is an all-hands-on-deck situation, and it takes us working in different ways to move the needle forward, right? So organizing is a constant state of being. So we're really going to lean into you all to help amplify the work. But when we think about health in particular, I started off my career as a community health educator, and it was Irving Goldson, and may she rest in peace, 30-something years ago, who introduced me to the love of community and health. And in that journey, very early on, started realizing the disparities that exist in terms of the lifespan of our people. In the city of Boston, we know that, when we look at Roxbury as opposed to Beacon Hill, there's a 30-year difference right there and alone, right? When we look at the quality of food that we have access to, we have these little local bodegas, right? You're lucky if you get fresh foods, fruits and vegetables in these spaces and places. That is health equity. When we look at the educational system, and we are always sending our kids to school with a backpack full of trauma, but there are no support services to really create space for young people to be fully expressed, yet we're feeding the school to prison pipeline because we're not equipping our schools with social workers and folks who can provide the type of support system that our young people need. When we look at housing and the disparities that exist in terms of like the number of folks who have asthma in our communities, we're not looking at health disparities. So there's a lot. And every time you step out into the streets, you're a victim. And so all of these things are interconnected and go right back to where is health. I talk about the fact that I was considered a geriatric mom. Yes, ladies and gentlemen. I had my daughter in what they considered late age. And when I was navigating the healthcare system, I was forced into having a C-section because they didn't think I would understand what the need would be for me, or they didn't allow me to make my own decisions. And when we think about Black maternal health, this is happening across the city of Boston. Women are being denied the right to be able to choose the type of birth that they want to give. And so that disparity is real, and there is opportunity for us to really lean into this conversation with research and data, because people are doing this work across the country to really look at racial disparities in the healthcare system. We know it exists from the way they treat us when we walk into these institutions, right? For the amount of time that we have to wait to be seen. All of those things are well documented. And so this is why this conversation is so important in the here and now, because the question is not so much, do we know? We know it. We've been known it. The question is what are we going to do about it? And that's why we believe through the work that we'll, actually when I say the commission, because it's not what we will do as legislators, is the commission is set up for the commissioners to decide for themselves what reparation is going to look like. But one of those key conversations that need to be had is we already know what we know. Now it is, what are we going to do about it? And that's, I think, where I believe the energy really needs to focus on, is because we're tired of being tired, right? And this whole idea, and there's a little quote that I'll just share here with you all, and you all can share it out with the world, is that nothing about us without us is for us.
Yeah.
Okay? Say it. Nothing about us,
Nothing about us.
without us is for us.
Absolutely.
And so even when you design a survey to determine whether or not you are being racially profiled or disregarded, that needs to be done in community, because the community for itself can dictate what those solutions are. And that's not the norm. The white dominant culture has always been created to do for us, not with us. And I think that this part of repairing the harm has to be part of the conversation in terms of how we really repair. And it has to start with that.
Thank you so much, Julia. And earlier in the day, we heard sort of, is COVID, I think it was in the conversation between Dr. Bassett and Dr. Galea, like, has COVID opened some sort of political opportunity? I'll go to you and Saskia.
Yeah, okay, because I can talk a lot. And I'm trying not to be that chick that talks a lot here. So, but, you know, when COVID first came onto the scene, I said it was a blessing in disguise, because it was going to create an opportunity for us to really act like we can't see the truth anymore. And so we saw it early on, and we already know when I think it was a Congresswoman, Ayanna Pressley, talked about the fact that when Black folks, when the flu comes, we get pneumonia, right? That's kind of the whole idea. But COVID really created an opportunity for us to say, see, I told you, right? You could no longer deny the reality. We saw it. And even when we think about, I just recently was on another panel with The Color of Care that Oprah put out. And I was really struck by one story in that documentary, that the woman was talking about her husband, who was the bus driver that was, who had passed, that he lied in the hospital, dead for a day, and no one even knew or called her. that even in the moment of death, we're still disregarded. And that is something that really struck me, and something that I think it's important for us to highlight, that even when we die, we still deal with inequities. And if that doesn't speak volumes in terms of the work that these times require, I don't know what will.
Saskia. So for me, the COVID talks have helped on a social level, but in actual, conversations, I found actually the data from the Boston Harm Reports. Dr. April Ennis's work there has been critical and instrumental to help shift the conversation towards reparative justice, because it is much bigger and broader. And frequently when you speak about COVID, it is understood as just, a virus and getting sick. And when I actually talk about the health of our community, I'm talking about our systems alignment approach. I'm talking about housing and mold exposure, asbestos exposure. I'm talking about environmental racism and lead in our soils so that we cannot grow. I'm talking about land injustice, where we do not even have land to own. 96% of farmland in Massachusetts is white owned. So it really begs the question, whose right is it to grow? Whose right is it to consume? When you're forcing people, forcing them to be codependent upon grocery stores where food is being brought in from internationally. From an immune system perspective, your food needs to be grown locally to strengthen your immune system. That way the environment, what you're growing is protecting you from the environment, the immediate environment that you're within. This is a holistic approach. Also with our Black community, food growing is a practice of spirituality. Our connection with our land and our plants is also spiritual. This is also being completely stripped from us. And this is really critical when thinking about also medicine, plant medicine, and within plant medicine lies cannabis. So the way that we grow our food, the way that we grow our medicine is not like white people, and that's fine. But we cannot have a one-size-fits-all type of approach. So I found that for me, I have to use data from the harm reports to help amplify what I'm trying to achieve. And then I just got busy. I started a reparatory justice grow to consume program. I found the state of Massachusetts extremely negligent for the past 2 years since COVID hit. Zero funds have gone to address racial disparities from health from the Massachusetts Cannabis Control Commission for responsible consumption. And since its founding, zero funds ever have gone towards Black communities to educate us on responsible consumption and what does it mean? What does your rights mean, actually? So a lot of people still don't know anything. And then to be approaching this from an interdisciplinary approach, a systems alignment approach, where you're having food justice, your health equity approach, land justice, addressing land trauma, addressing the fact that land has been violently ripped away from people, and how do you actually reconnect to the land so that you have a relationship with the land and the plants. None of this has been being done except with my group. So we've just been getting busy and really trying to get in there and bring healing and listening. It's critical. Like we do a lot of amendments throughout. After every workshop, we listen, how did this feel? And we make amendments as we go along. So it's constantly tweaking, and it's allowing the community to lead and then to be making amendments to program development so that we're fine tuning as we go along. But yeah, for us, it's very, very much been the harm reports. And I can't stress that enough, that we really have to take this serious. We have to develop harm reports. In Cambridge, we actually have 13 areas. We included climate change, we included transit equity, we included environment, we included urban agriculture. We included like several areas. We really want to go in depth and address racial inequities through a multi-intersectional approach.
Well, it's really good to hear that these harm reports and researchers in the rooms have a role to play in producing that data. And Robin, I'm going to turn to you because housing, as you said to us, it was Evanston's sort of the beginning and what And of course, everybody in the room who knows about social determinants of health, housing is a key one. In your work with First Repair, advising other local reparations efforts, how does health come up? Does it come up explicitly in healthcare access conversations, or is it around public health? Is it around COVID? Is it around housing and land?
I'll say it comes up in every reparations conversation in every community, whether big or small, diverse or not, it comes up as a priority. And across the board, there is a lot of concern right now about trauma. We are learning more about the harm that's in our gene, a report that you can learn more from Cam Howard, who's here, and transgenerational epigenetics and how we are carrying that. Even healthcare access and so on. I mean, there's no limitation on where health comes up in the reparations discussion in every community. And so we're looking, in Evanston, we have decided that we have a narrowly tailored framework, legal framework for reparations. And so our remedies are in direct correlation to the harm of municipal law. And so that left it outside of our purview, but it remains a priority. And we have an additional reparations community fund, the Reparations Stakeholder Authority of Evanston, that will allow us a space, infrastructure, and funding to pursue health, equity, and reparations as it relates to health in Evanston.
That's really helpful. And I know that it says up here, please, queue if you have questions. We do have another 20 or so minutes for our talk, and I am running behind all these questions, so I'm scanning through them. I do, Yvette, maybe I can turn to you quickly around, and actually it's not only to Yvette, it's to everyone. It's around the question of, the price tag. In the last session, we talked about the cost of inaction. The price tag often is said that it's a political non-starter, but then do we think that the evidence from the health research community, the data showing the harm, does that help? Could that change the political calculus? And, and I know you've been part of the global conversations, how do you get around this price tag? What are the arguments that people are using across the globe and then here in Boston?
Well, I want to start here first, as one of the commissioners, founding commissioners of NARC, and sitting in the space with Dr. Conrad Worrell, may he rest in light and peace, my colleague here, Cam Howard, who I call the Queen Mothers, Nana Joanne Watson, Iva Carruthers, and Joyce King. We traveled the country. Cam, I don't know if you remember when we stood in New Orleans and people came in lines to tell their story to the commissioners. It wasn't about the money. There's no amount of people, the community does not see any amount of money that could be given for the level of pain and suffering that the African American community has had to face in this country, the history. And then the next layer of the African diaspora, those who come behind, who are walking these streets based on the African American reality. That's another layer, those vestiges, the Jim Crow, the segregation, the housing, the health disparities. I find it absolutely difficult to put, much respect for the last panel, but very difficult to put money, a number, on the level of suffering and pain and the repair that's needed. I come from a thinking, Joyce Hope Scott, Dr. Joyce Hope Scott is one of the co-founders of INOSAR and Boston Pan-African Forum, also a professor here at BU, speaks that our repair happens internally first, with us. And then, the bigger conversation is how we, get ready to go outside of that. There's no amount of money that I could give to some of the community. As a community organizer during COVID, I had families that didn't have proper internet that we had to get. I had elders that walked to pick up their medicine that we need to figure out how to get their medicine. I had folks that needed special food and they couldn't leave and how to figure that out. And then every day I had folks, and once a month we created with the UMass, my colleague, Dr. Tahira Abdullah, a collective of mental health clinicians to create a space for the community to come and share what they were going through. As a trauma responder, I saw it firsthand. I was a trauma responder for 3 years in the streets of Boston, going to every homicide and suicide. And let me tell you, the only Black woman on the team, even if I was not the responder that was in charge of that call, I became more involved than my colleagues because Blackness speaks to Blackness. Blackness speaks to Blackness. So they knew that even if wherever you were born, wherever you are, you have a level of understanding when you see a Black person to be able to say, I see you. I understand what you're going through. Maybe not fully, but been there, done that. So a number, I watched, I've been sitting with Barracoon all week because I watched the Netflix film Descendants. And you cannot repay the level of pain that Black folks, African American folks have had to deal with in this country that we still deal with today. There is no number, there is no amount of money that you can give anyone here that's going to justify the killing of Breonna Taylor, Trayvon Martin, George Floyd. No money is gonna bring that back. No money is going to make Africatown not the industrial receiving complex that it is. No money is going to help Councilor Mejia address the inequity in the education system here in Boston. Frantz Fanon says, wretched of the earth, for it to be changed, it means to shake it all up. I want white folks to get out the way. If you're not an ally, get out the way. And let us do for us. We are the ones we've been waiting for. We are the ones who live this. We are the ones who have to deal with this. We are the ones who will repair this. Why are we going in this afternoon with the possibility of Boston not having a commission? Why is reparations still such a threatening conversation? It's 2022. This country is in a crisis. Either you will repair what you have done, or the signs will continually be before us, and we will be back on a panel next year speaking of another COVID rapid thing coming at us, and Black people being on the receiving end of all of it. No number.
Thank you.
Can I just share something?
I was going to open it up to the audience, and I was thinking about, please share, and then we will open it up.
Okay. I just want to say something to you guys that as much as I stress data, I've been a part of many data collections. One of them was with a program called One Family. And within this program, we did a data collection and presented it to our state officials that it's actually more expensive to do shelters than to house families in like one-bedroom apartments or in motels, right? Nothing's changed.
That's right.
Nothing's changed. Okay, so they have the data, they have the numbers. As important as it is for me to stress that we do need the data, negligence is intentional. So we have to really, really have the difficult conversations, communal conversations, creative conversations on how do you hold systems of accountability when the people that are upholding them are intentionally negligent. And that's when we get into the fun part. Because sisters say we're going to be here next year having the same conversation. I say vote these out. They got to go. They got to go. That's the energy you have to have. You have to remind them, I'm the people, and you answer to me. That check you got, I give that to you. and you're not doing your job, so you got to go. Like yesterday, you're out of pocket. Me and my people, we're not having it.
That's
At
right.
the end of the day.
To Julia,
You know, so that's the energy. That's what I'm talking about. That's my energy. Like, you got to go. If you're not, you in the way, sayonara. You won't, and it's not a threat, it's a promise.
That's right.
I'm in your streets.
That's right.
I'm in your district, knocking on those doors, so the people know how much you caused harm. And that way we can have the change, because you're hurting us as a community. And the government is causing friction between us as people.
That's right.
We're not going to allow the government to do that.
That's right.
We have to stay together in solidarity. So if you're in the way, sayonara, we're going to find somebody else up here, we're going to vote them in, and this is how we're going to keep it moving.
That's right.
Ashe.
Yes. So, you know how much I love this energy right here, right? Because I only won by 1 vote in 2019. And then 2 years later, I almost topped the ticket, right? Because that's what representation does. But the problem is that there are a lot of folks who come into office and they see themselves as a politician or an elected official. But in reality, we are public servants. We are here to serve the people who put us in office. And this power dynamics, the real power is the people, right? We talk about, how do you want us to spend your money when we do the budgets? Because that's not a conversation that people have been invited to. It's always, we pass the budget and say, thank you very much. But no, we are changing the way we do business because of that. Because in reality, we have to change the mentality. And we always lead, when it comes to our people, we always lead with our deficits. And we talk about how poor we are. We never talk about how resilient we are. So I've been pushing, even in the council, to change our language. Because even as something as simple as leading with our assets can really change the conversation when you're just focusing on our deficits. And I would say, to the question about how much, whatever that is, add tax. Because this conversation is just, I'm not coming back here next year. And we're not going to have this conversation all over. My hope is that the people really understand that power. So when it's time to vote, all of my 13 colleagues, and if you're all alive right now, letting them know they've been put on notice. They represent the city as a whole. This is a conversation that impacts all of Boston, and everyone has to lean into it. And I think that is where I believe the opportunity is for Boston to really get rid of its racist narrative, right? This is the repair right now, y'all. Y'all really don't want to be seen as a racist city anymore. Reparations now, and that's it. Bottom line, period.
So I knew it was going to be impossible to time keep this amazing panel. We do have 10 minutes, and what I'm going to suggest is actually we listen to the questions. We might not get to answer all of them, but I think for the audience to hear what is coming up in people's minds. So we'll listen to the questions, and then if we can we'll do a rapid round if there's time. If not, the next panel, it will be on them to try to answer these questions or over the lunch. But let's listen to all of you, please, and introduce yourselves.
Hello, can y'all hear me?
Yes.
My name is Azariah. I'm a second-year master's student at the Harvard Chan School of Public Health. And I'm from Boston. I'm from Mattapan. I graduated from Brockton High School. Senora Mejia, you talked about kind of Black life not being valued at death. And Senora Jenna, you talked about kind of internally healing before we can fully heal. And I wanted you to touch a little bit upon the gun violence that is happening in our communities. As a Boston native and a current student at Harvard, it's really hard for me to separate my life and my identity because I feel like I exist in two different worlds. And the killings of Black people in Boston is not talked about on this campus, of Black youth, and also how we can bring that conversation to Latino communities in the Caribbean and Latin America, where we are also being killed in our neighborhoods due to gun violence and access to guns. Thank you so much.
Thank you so much.
First, thank you all so much for sharing your time and your expertise and your knowledge. My name is Miriam Ashkenazi. I'm the program director for the Institutional Anti-Racism and Accountability Project at the Harvard Kennedy School under Professor Khalil Gibran Muhammad. And I also happen to be a select board member for the town of Brookline. Talk about, yeah, talk about it all. My question is actually primary for you, prior Alderwoman Robin Rue Simmons. You know, if we want to bring something similar and start something similar within Brookline, which is really a racist place, and really it fights its racism, like in the complete wrong way, right? Oh, we're not racist. Look, we're liberals. We vote for Biden, right? It's almost impossible to have a generative conversation. What would you have done, or what would you advise, or what would you have done differently from your learning to now to advise somebody like me and my colleagues, many of which who are actually here, to move forward with that kind of, Darity said you shouldn't be doing reparations bills at the municipal level. I don't know that I believe that, but what should we be doing, or how should we be pushing this, because it is political. We have to find the political will, but how do I get my toe in the door? Thank you.
Thank you, Dr.
I hope we can share some of lunchtime together.
Yeah. And I hope everybody finds value. These questions are so rich for me, so I do want to continue asking all of them, and if we can get to them. So please go ahead.
Good afternoon. Yes, good afternoon, everyone. My name is Aziza Robinson Goodnight. I have worked very closely with the group pushing towards the Commission for Boston. Also, in this context, I am the co-lead investigator on a research project with Northeastern University investigating the intersection of art, race, and health. One thing that I've noticed in organizing here in Boston is that there is a lack of representation from the African American community. We do have a council that has 0 African Americans on it, but has been a strong hold in the African American community and continue to keep us here. I enjoy working with my brothers and sisters that come from different tribes to this land, but it has been a struggle to get the value of the African American experience put at the forefront. So my question is, and I'll premise it with this. I worked for Lily Marceline at the Resilient Sisterhood Project, and she had me watch a documentary called The Bow is Broken, or Breaking the Bow, which outlined the research of the mortality rate of African American women in comparison to African American women with premier degrees, eating well, have everything for them, have everything for them in comparison to our immigrated brothers and sisters, and also white women that probably eat trash and have no education. And we still have, because of the trauma inflicted upon us on this land, we do not have an escape. No land has opened up their doors for our asylum. We also are not a poor nation. We're also asset rich, and a lot of the voices are coming from not an asset rich voice. How do we deal with that without the conflict or oppression Olympics with each other?
Thank you, Aziza.
Thank you so much. My name is Imani Fonfield, and I am a sophomore at Harvard College. I'm 19 years old. Thank you so much, all, for your words. Most of my passion in health justice comes from my own story. My sister passed away from an asthma attack in 2001. I was a caregiver for my mom, who suffered many diseases and has been misdiagnosed multiple times. And I lost 5 family members during the COVID-19 pandemic. And so overall, as a student at the college, I agree with your sentiments that we feel like people who have been who have faced oppression and are now students at Harvard. There's this double life that we're living, how can we gain our voice as advocates? And for me, as a pre-med student, how can I empower myself to keep going, knowing that many of my other pre-med peers have benefited and have inherited some of the privileges that have come from oppression of our own people? How can I empower myself, and how can we empower us on campus, particularly the Harvard Undergraduate Black Health Advocates, which I'm co-director of? How can we mobilize each other and work with the greater Boston area, with Cambridge, with our local communities outside of campus, which we seem to be glued to, or we don't have a voice within? How can we mobilize and act?
Thank you so much, Lavona.
Thank you so much.
Sorry for your loss. I do want to say that. Thank you for sharing with us. Please.
Hi, my name is Gabby. I'm a student at the School of Government, and I think sort of related to some of the questions that have been asked, like these types of conversations aren't really happening at the School of Public Policy across the river, and so I guess I was just wondering if you could share any thoughts you had in terms of how to bring the conversation over there in a way where like the negligence feels really intentional to what y'all were talking about. So any thoughts you had on that?
Thank you so much. So it is 12:30. Did you get to ask your question? Please go ahead.
So I'm Dr. Danny Ritchie, a clinical assistant professor of family medicine at Brown University. I also run an organization called Community Health Innovations of Rhode Island. I do get a chance to teach undergraduates about policy, discourse, and culture that shape health and healthcare. My heart hurts listening to this. And I'm a person who's tired of being tired. But I want to talk about, and this is a lot of this work that I do, the toxicity that continues to harm us, harms everybody. This is everybody's fight.
That's right.
And we have to let people know that what they're doing in order to maintain their control and power is making their family sick.
That's right.
And how do we make sure that we have that conversation and that they don't think that we're just talking about our repair, because it's about their repair too.
Can we answer one?
Yes, I think.
Do y'all mind staying a little bit? I'm gonna take over the job.
We're gonna do 5 minutes. We're gonna do 5 minutes. We're not gonna get to answer everything. You get 1 minute each to answer whatever. All of those together. Yes, 1 minute, Julia.
Oh my God, we need to do part 2, okay?
Part 2. Yeah.
So, first of all, just thank you for bringing so much of yourself into these questions that you brought to us, because I think at the core of what I just want to offer is that we have the power. We have been led to believe otherwise. And when we're in classrooms or boardrooms, or any space you're in, you have to speak up and change the conversation. Redirect it to what we need to be leaning into. That's number one. Number two, while I do appreciate Harvard's $100 million, that is not enough, because it's not just about the money. It is about how you're teaching and how you are engaging in community that you are occupying space in. You can't just parachute and then just give us some community benefits. No, that's not gonna work. Harvard needs to do more than a financial investment. You have to look deep into your curriculum and revise it. If it's white dominant culture led, throw it out and begin all over again. Because these moments require our people to be seen and fully heard and expressed, and listening to the stories that you've heard here today, being accountable to that, and making a commitment that you're going to do business differently.
Thank you. Robin.
Thank you. And thank you for this symposium and widening and broadening this discussion beyond a cash benefit with health, centering on health. I just want to say that I hate that I missed the last panel. I really wanted to be there for that. I feel very strongly, many of us, Providence, Rhode Island is here, Amherst, Cambridge, Boston, over 100 municipalities now and more states are advancing local reparations, and it is affecting federal change. We have more co-sponsors than ever in the House for HR 40. This is a way that we can get it done. not completely at a municipal level. There's not the capacity there, but we have seen the successes. It is attainable. And so for those that want to take the next step, I really just want to offer up our work at First Repair. We basically share best practices with one another and support each other in advancing local initiatives. Again, there's over 100. You can learn more about that mapping tool at redressnetwork.org, firstrepair.org as well. But it is attainable. We can take a next step. Don't be paralyzed in what's the number and how do we accomplish it. We can't accomplish full repair at any individual level or with any institution. It's going to be a collective, collaborative effort for us to get to full repair. And I would encourage everyone to take the steps that you can within the spaces that you're in and lead boldly. So much to say, and I'm just going to be quiet.
Saskia.
I just want to remind you that the revolution starts with yourself. And so wherever you're experiencing harm as a Black person, I just want you to center yourself and to ask yourself, what is it that I am missing here that's going to help me feel whole and seen? And I can fully live here instead of just surviving in this space to get through to whatever to the journey that I'm trying to take. And within that answer, you're probably going to find a solution that will not only benefit you, but benefit other Black people that are experiencing the exact same harm. So start with yourself, asking those tough questions, journal in a pen, and get busy. And the other thing I would plea with you to do is to approach us. We are all organizing. We are all moving in solidarity. We are not here just to give you lip service. We are action-oriented people. I am action-oriented. It is my job to multiply myself. I've had several dozen, literally, I've had several dozen action circles this year alone on reparative justice. I've had people come all the way from London, because it was virtual meetings, to attend and learn how do you approach reparations. Everybody can get busy, so you should not walk out of here without an assignment for yourself. If you walk out of here with just the notebook that was handed to you and, oh, I learned so much, but you did not actually get a phone number, a business card, an email contact of one of the speakers today, you have failed our community. So get busy, because this is all collective work. It's not, we alone cannot do it. It is because there is a collective of people doing the work. So let's all get busy and let's work collaboratively, communally together.
Last word to Yvette.
Everybody take out your notebooks and your pen, because I'm going to pick up where Saskia left off. But first and foremost, it's been a pleasure to be on this panel. I was saying to Robin that we've been in spaces together, but we've never met in person. So this is a big, really a nice treat. And then, Julia and I are, doing the thing. We do the thing. So I want to thank for creating the space. I want to use my time. So 2 spaces, I call ourselves the Black Reparations Collective, Aziza being a part of it, facilitated by my colleague Jason Boyd from the Black Mass Coalition and Tisha from Embrace Boston, and Reggie and myself, Kathleen Anderson from Amherst. And we're the base, we do a lot of the base building, going out in the community, collecting the signatures. So if you are interested in learning more about that work, feel free to send me an email. It's my first and last name, Yvette Modestin, YVETTE MODESTIN 15 @gmail.com, if you want to learn more about that on the ground work that we do into the community. And number 2, as it relates to, Encuentro Diáspora Afro was founded to repair how we see each other as Black people from wherever we are at. Encuentro means the gathering, the seeing, the coming together of the African diaspora. And I feel that we can do the bridging of understanding between all the communities of the diaspora. So November 30th, 6 to 8 p.m. at the Bruce Bowling Building in Nubian Square, Encuentro Diáspora Afro, UMass Boston Africana Studies Department, Councilor Mejia's office, Embrace Boston, City Life Vida Urbana, Boston Pan-African Forum, UMass Boston Mental Health Team are coming together for a first series called Let's Walk Together, Caminemos Juntos, in Portuguese and in French, all those communities, because the African diaspora community is a large community here in Boston, and we not only need to see ourselves in the reparations community, in the reparations conversation for ourselves, but we need to come in solidarity with the African American community. So the Afro-Latino community is not a self-identifying Black community. That's a struggle, even as a Black Latina. LA Council fiasco was not a surprise to me. I've heard worse. So this is an opportunity for all of us to come as people of African descent in all the colonized languages that we speak, but to be able to understand why this is a conversation for all of us to be engaged with. Self-identifying or not, this is about you, because when we walk out on that street, ain't nobody know that Robin's from Evanston, Julia was born in Santo Domingo, Saskia is in Cambridge, or I live in Milton and come from Panama. We Black until we open our mouth, and then something else might happen differently. We need to know that truth. We need to practice within that truth. We need to repair from that truth.
Thank you. Y'all can you hear me? I'm so full, like the day has been building and this session has been so filling, even though I understand clearly the pain, everything that we feel as we start to share our stories, share our experience in a collective space. But I so appreciate you all shifting, redirecting, refocusing the narrative that we can show up as our full selves and that we're allowed to, but it's imperative that we do. So just really thank you for the space and the voice and all that you've created for us right now. Really appreciate it. So before we break for lunch, it's that time, I do want to acknowledge Bonita Adib of Ujamaa Seeds, and Bonita I rode with on the car where I'd hear, where are you, Bonita? There she is. There she is, wonderful. Can you just, well, she waved, she doesn't have to stand. But I would like for you all to just really know that Ujamaa Seeds is part of a BIPOC-led collective that aims to increase diversity in agriculture. And earlier was mentioned that growing is a practice of spirituality. Somebody said that in the discussion earlier. And Ujamaa's mission is to recover and reclaim our culture, our heritage, steward it, and make sure that it's available for future generations. We've worked with them to assemble collections of culturally relevant seeds for all of our guests here today, and we'll set them out after lunch so that you can pick them up in the lobby. So we really want to thank Bonita and Ujamaa for doing this and sharing this with us today. So we'll break now, and it will be set in the lobby. Please feel free to go outside. I know it's a beautiful day, so enjoy it. And please be back at 1:15, please. 1:15. Thank you.